We are born as nasal breathers. Okay, the way our voice box and our throat is and everything, we pop out of the womb and we are all nasal breathers. Okay, and that's how we're supposed to be. But many people are mouth breathers, and if you're a mouth breather as a child and as an adult, it'll set you up for having tooth decay, set you up for having gum disease, and it'll also set you up for having downward growth or retruded growth, and it'll guarantee you not to have enough room for your wisdom teeth, and it'll guarantee you to have crowded teeth, so that you are going to, some dentists might say, well, you need to get braces. Okay. But that's all a factor of this mouth not getting as big as it used to. All right. Now we all have the genetic potential to get that big, but because culturally we're not using these muscles and we're not breastfeeding. Breastfeeding is another way to use your muscles. A lot of us aren't being breastfed, or we're not being breastfed long enough. The experts that I've been listening to the past 2 years say we should be breastfeeding for a year minimum. Breastfeeding and bottle feeding breast milk are not the same thing. Okay, a lot of mothers are pumping and then feeding their child breast milk through a bottle. Okay, well, yes, it's good to get the breast milk, but the action of getting milk out of a bottle is not the same as getting action out of a breast. Okay, yeah, you can put a big hole in that.
It's easier, so the baby can develop a strong jaw muscles because they're not using it.
Exactly. So many cultures, and also there's a lot of folks who are into breastfeeding in this country, and they really feel, I mean, you probably all have friends that you've seen breastfeeding their children at 3, okay? Now, my mother would think that's terrible. Why are they breastfeeding at 3, okay? Because my mother took me off the breast at 6 months, okay? Well, I shouldn't have been taken off at 6 months. I should have gone at least a year, okay? But in our culture, with the Industrial Revolution, women are going back to work quick, okay? We don't have time to breastfeed if we're only going to have how many weeks of maternity leave?
6.
You have 6 weeks of maternity leave, okay? That's not a year. So, culturally, if that's what we're going to do to our children, well, we've got to be aware that because we didn't breastfeed as long as we possibly should, when we see that the mouth is not developing as fast as we would like it, we need to intervene. And we need to intervene maybe at age 3 to start encouraging people's jaws to catch up. All right, so I would propose that we dentists need to be looking at our young patients, and parents need to be aware of this, because there's a lot of parents that don't really take their children to the dentist until maybe they're 5 or 6, because they're like, well, they're just baby teeth. Why do we have to go to the dentist? I mean, that sort of makes sense. They're going to be replaced, right? Well, the baby teeth help guide the permanent teeth in. The baby teeth are extremely important, okay? But if I notice in a 4-year-old that their mouth isn't developing to the size to let the bigger permanent teeth in, I ought to be helping them. I need to catch that baby up, or that child up, because maybe the baby wasn't breastfed long enough. Because mom